Hey, what's up, everyone? This is Julie, aka Nurse Jar. I just wanted to drop in on you all real quick because I wanted to share with you a sneak peek of the online nurse aid exam prep course that I am developing. So I'm going to go ahead and square. You see how tired I am. I'm going to go ahead and share my screen with you. Um, so you can get a peek at what I'm working on here. So these are the current courses that I am developing right now. I have Pearson View or Credentia, test takers, Prometric, Headmaster, and the inimitable instructor. So I didn't forget you, my fellow instructors. Okay. This course is actually going to be a really good, fun course for instructors to help you reach that inimitability status, help you increase your pass rate if you're struggling with that. But also just to, learn how to become inimitable and most importantly, maintain, being inimitable. But I want to take you all to one of the courses. Now, Headmaster Prometric and Pearson View, they're going to be identical courses, but specific to each authorized administrator. Okay. So if we go here, I'm just going to go to edit so you all can see the different lessons. Each course so far will have 8 lessons in them each. They're going to have the welcome message, exam day. And basically, on the exam day, I, share information with, how to best prepare for exam day and also what to expect on exam day, and then the indirect care behaviors. And I'm sure we all emphasize these throughout the training cycle because they are so important. They're in correlation with, patients' rights. And during testing, your student will be evaluated and scored on these, five indirect care behaviors from start to finish of their manual skills exam. So I dissect these uh, behaviors for them, in a compact style or manner to give them a better understanding of each of the five indirect care skills that they will be evaluated and scored on during testing. I break it down for them so they can gain a really good understanding. And I also share with them information in regards to what the nurse aid evaluator will be looking for. And then we have the supply items labels here. I don't know about y'all, but every year, it just never fails. Students have a hard time remembering the names of the supply items, right? It's always, that thing that you place underneath the patient, well, what is that thing called, right? And I try to stress throughout training the importance of knowing the correct labels for these items and equipment because in real life, you may be in the midst of an emergent situation where, seconds count and you're going to have doctors and nurses screaming and yelling out directions to you, telling you to go get this. I need an ambu bag or I need a non-rebreather, get me an e-tank. And if you don't know what those items are, that's going to put that person, that patient, resident, or client at a higher risk at dying, right? because we as nurses and doctors, we don't have time to stand there, and explain to you what a certain item or a piece of equipment is, right? And so I, stress to them the importance of knowing this. Excuse me, guys, I'm so tired. Like, I'm working really hard on this program, like day and night. I even work on it during my sleep, I think, right? But I'm just going to open up this item here. I have all the other lessons. I reverted them back into draft mode because I actually registered all of my students today. And I assigned them this particular lesson here. So I drafted all the other ones because I didn't want them, going in, sneak peeking to see, what the other lessons were about just yet. But I'm going to show you an easy way how you can assign them these lessons, especially, if you use Google. Excuse me. Told y'all I'm tired. Google Classroom. But let's go ahead and I'm going to give you a sneak peek on this course here. So it gives you the option of viewing, in cell phone mode or tablet or computer. So I'm just going to click here on computer. So it can be a little larger for you to see. We're going to click on this. Okay. I just give them a little blurb, of the importance of knowing the labels or the correct names of the supply items. And then these are timed. Okay. So the activity starts now. What they have to do is drag the supply item over to the correct label. And how I have it right now is I have them, if they drag it to the wrong label, it will reject it, right? And I have it this way because I think that it will actually help them to retain the information more because they keep going back trying to drag it and then they finally get it, to that right spot, right? And then it just gives them like a little motivational um, phrase, like, hey, your supply items, right? And then they can go ahead and click continue and it moves to the next supply items and they'll do the same thing, right? They'll just drag it over here. Um, ah, there we go. They'll drag it over. My computer is acting up. And then when they click continue, it will let them know, hey, that's correct. And again, a little motivational phrase, you're on a roll, guys, right? And they'll click it. Now, all of these supply items are for testable skills only for both, Pearson View, Prometric, and Headmaster. I just put them all together, okay? So let's get back out of here and we're going to go back to Prometric Test Makers. And then the next lesson is on collection of supplies. And I'm going to go ahead and revert this back to being published so I can show y'all this one here. Let me switch it over to computer mode. Um, this one here will actually, or this lesson here will be specific to the authorized administrators, okay? So it's going to have all of the testable skills, whether they need to collect supplies for them or not, okay? So if they actually click on here, because it's going to tell them down below to select an item to see more. So if they click on the box here, it's going to give them more information. So for hand hygiene, it's going to let them know, hey, there's no supplies that you need to collect for this skill. And then they'll click continue for ambulation. They'll click on it, right? And they'll, just more information. The gate belt is the only supply you need to collect. And then this is for bedpan. If they click on gloves, it will, tell them you need to collect 2 pairs of gloves. Okay. And then they'll just have to keep clicking on these I'm sorry, guys, these boxes here to get the more information. Okay. And then let's go back out here, and I'm going to put this in draft mode again. So the next one is test your knowledge, right? So they first learn the correct labels of the supply items and equipment. Then they come over here to this lesson. They will learn what supplies to collect or what they're going to have to collect for each individual skill. And then this next lesson, they're going to get tested on it, right? So let me publish this here, and we're going to click on it, and let's go. Now, all of these activities are timed. So what they have to do now is just click on the supply item that they will need to collect for each skill. And you can see the time running out. So I'm going to click on it here and click continue. And yes, that's correct, right? It'll let them know whether or not they, collected the right item and the right amount of items. And if they don't, it will, let me show you here, right? It'll let them know that they didn't and what they need to collect. So now we need to collect for bedpan. Let's say they get the toilet paper, they get the 2 pairs of gloves. For Prometric, we need that clean barrier. We also need a linen protector. And let's say they click on the fractured bedpan, right? And it's going to let them know, not quite, right? And then it tells them what they actually need to collect. All right. And so that's for all 22 Prometric skills, except for, well, 21, because the 22nd one is the oh, guys, I can't think. The indirect care skills. So we're going to go back here. Let's get back here. And I'm going to go ahead and put this back in draft mode. And so these are the two lessons that I'm working on right now, the manual skill steps and the written knowledge test. And I think I might have something in here already. Let me see. So basically, this lesson, what I've done is I've grouped, um, let's see, I've grouped the steps together, right? So you know how, like, step one is to greet and address the resident by name and introduce yourself by title. I just went ahead and threw in explain the procedure, right? And so that way, like, I think hand hygiene has 10 or 11 steps. And the way that I've grouped it, it has 6 steps now, right? They'll have to, click on each item, okay, and to get information. And once they've clicked on each of these items, okay, we're just going to click on all of them. It will continue to view the next steps in this skill. And then we have, step 7, right? So I turned 10 or 11 steps into 7 steps now, okay, if that makes any sense. So, the skill itself won't look as intimidating, it won't have as many steps, okay? And then I have, or steps, 8 steps, I'm sorry. And then I have like the critical element steps. Now I know Prometric doesn't have critical element steps, but I'm just using these for Prometric so they can have like a really, you know, understand the importance of certain steps in, each skill, right? Like for hand hygiene, you have to wash your hands for at least 20 seconds and make sure you rinse all of the soap off of your lower arm, wrist, hands, and fingers, right? And then I just give them a tip on making self correction. So this is how it's going to be for all the testable skills with all of the administer
Hi,
this. And then I
everyone.
have
It is so
a
good to,
video in
and
here
just let me
where
know whether or
they
not,
can, I'm going to skip through this,
as I am
right?
washing
So
my hands.
I have a
Now I'm going to
video of
lather my hands for
each
at least
skill,
20
so they
seconds. To
won't have to
ensure that
like,
I get
you
20
know,
seconds,
go
I'm
to
going to use the
YouTube
storm count,
and,
such as
watch a
1
video or
1000,
anything. So
2
I'm having
1000,
the
3
videos
1000, 4
embedded in
1000,
the
5
lesson.
1000,
If they don't
6
need to watch it,
1000,
they can
7
always skip
1000.
the video, right? And go to the next lesson screen, okay? And then excuse me, guys. I'm gonna go ahead and draft this again. And the written exam, knowledge exam is going to be the same. In this lesson, I'm actually going to share with your students, 4 test taking techniques that I have developed over the years. I actually developed them a couple of years ago, and they have proven positive. You know, for my students, excuse me, both with, exams and tests and quizzes that I give them in class, plus their certification exam. So it's 4 test taking techniques that I share with them. It's going to have like a couple of practice questions for them to do. So, they can like, uh, you know, understand the test taking techniques, but it will help increase their chances of selecting the correct answer choice during their written exam. And even, like I said, exams or tests that they may have in class. All right, guys. So once you, um, once I get your students registered, you as the instructor, you will be listed as their instructor. So you'll have access to the peer, what is it called? Peer, oh, what is it? Let's see. Uh, Here we go. Peer authoring, yeah. Okay, so you'll have access to that. I'll also give you management access for your students. So you'll have access to a manager dashboard. And I'm going to click on that now so you can see how it is laid out. And while it is coming up, guys, I'm going to take a sip of water here because I have been talking all night. Ooh, okay. And it usually doesn't take this long to pop up, but I don't know why it's doing it now. Um, Here we go. All right. So, as a manager for your students, if you look over here in the left legend, these are actually my students here. Okay, I have them grouped into my class periods. And over here, you can see in the top legend, it gives you a total amount of users. So these are all my students. Actually, what, 6 of them, I have 63 students. So I need to find out tomorrow why some of my students have not logged in yet, right, to complete their assignment. It's going to give you the number of courses. I don't know why this has 2 because they're only registered for the Prometric course. It's going to give you the average score of all of the users, okay, in the entire group. So right now I have it on all managed groups, and then also the completion percentage, okay. But if you just wanted to look at one of your class periods, all you'd have to do is click on that group, and then it will just list your students within that group, okay. So this is my first and second period class here, all of my students here, and I see that only 2 have completed the assignment, right? So it's going to give you their average score and their completion rate. This is my sixth and seventh period class here. Okay, and their average is 5% completion rate. So you can even use this as like a little challenging game for them. What? Only one person in my sixth and seventh period class has completed the assignment. Oh, they gonna get it tomorrow. They're at 3%. Okay, and then my third and fourth period class, Guys, I'm sorry, I'm losing my voice here. Third and fourth period class. Let's see. Come on, there we go. Well, I'm feeling a little bit better. Okay, one, two, three, four, five of my third and fourth period class has completed. And you can see their average completion rate is 15%. So you can actually use this as like a challenge, right? And say, hey, the group that has the highest percentage rate, on your next exam, I'm gonna, give you an extra 5 points, right, on your score, something like that, right? And then it's gonna again give you the total users. So in my third and fourth period class, I have 17 users. I actually have 20 students in that class. So I need to figure out what's up with the other ones that haven't signed on, right? But it just to really, so you're going to have access to this dashboard, and is down here. It gives you the percentage of the actual course, right? So you got the Prometric and Pearson view. Once I um, do, the headmaster and instructors, that should be down here too. But I don't even know why Pearson view is down here because I did not assign them to Pearson view. So you can see Pearson view is at 0%, and this is the average completion rate for this course, for all of them. So really, really good dashboard for you to have, and you can review your students' progress. You can come in here and look and say, hey, guys, how come y'all haven't completed this like I'm going to do tomorrow, right? But I have it due. It's not due for them till Thursday, so they still got one day to complete it. All right, but this is what I like about this. Okay, I'm gonna go back to courseware and go to my courses. um, I use Google Classroom for most of my assignments and exams, right? So you can actually, like here, you can, if you want to assign the entire course to your students, and these courses are not structured for the student to complete in one sitting. There's no way that they're going to be able to do that, okay? But if you wanted to just go ahead and assign it to them and tell them, hey, y'all work on this on your own at your own pace, you can actually click on the link button here. You can either send them the QR code or you can click copy the link. Okay. But I'm not going to do this. I'm going to show you what I did, right? Because I wanted my students only to become familiar with the supply name. So I assigned them this lesson only. So if you click on it, you can copy the link. Okay. I'm going to go here and I'm going to go to my Google Classroom. And so here are my, I got my sixth and seventh, third and fourth, and first and second. So I'm going to go to my first and second. I'm going to go to classwork. I'm going to go to assignment. And then here, I'm going to go ahead and paste the link and then add the link. And voila, there you go. Okay. So once you assign it to your students, I'm going to get back out. Let me get back out. Right. So if you assign it to your students, so here it is where I assigned it earlier, right? All they have to do is click on the assignment link here, and it takes them directly to the lesson. Okay. And they can go ahead and start the lesson and get her done. Okay. So if you use Google Classroom, again, you can share the link on Google Classroom. This makes it, to me, it makes it much easier, to do it like that. And then you can actually, um, you know, look in your Google Classroom to see who's completed it or not. But you'll have to come back to your management dashboard to get their percentage. Okay. So guys, that is it. That is the sneak peek. I'm gonna get out of here. I'm gonna get out of here, and I'm going to stop sharing my screen. So stop presenting. Awesome. Okay, so guys, that is it. Okay. Um, Why do I think this is going to benefit your students? Um, because it will enhance their training. It will enhance what you have trained them. It will enhance the knowledge that you instilled in them, right? So this course is not structured to actually train them on the manual skills or the written knowledge exam, but it's structured to enhance what they have already learned, to help them to retain the information, to help them get a more sound understanding of the information. It's an unconventional way of learning, especially when it comes to the manual skills. But the way that I have it structured, um, they're going to be able to remember those skill steps, right? They're going to be the way I have them grouped together, right? The actual skill isn't going to seem as intimidating to them, right? So a skill like partial bed bath with back rub, right? Maybe has 20 something steps. I'm going to break that down to where it only has like 11 or 12 steps, okay? So it's not going to be um, too overwhelming for your students, okay? And the way that I have the steps grouped is in the most logical way, okay? Even with the order dependent steps, right? I'm going to have those grouped. A good one would be ambulation, right? It has like about what, 6, 7, or 8 order dependent steps that are order dependent on standing the person. Well, those are going to just be grouped together. They're going to be compact, right? So it won't look like the student has so much they have to do before they actually stand the person. Okay. So, guys, that is it. Um, the price. I know y'all want to know the price. Okay. Right now, I have an introductory special or a promotional special um, going on once the course is up and running, right? And hopefully Prometric will be so within the next week. If you refer my students, okay, let's say that you don't want to offer it, through your school, but you think that it's a good program, right? A good online program, and you think that it will benefit your students. You can refer your students and say, hey, Nurse Jar has this online exam prep course. If y'all want to purchase, access to it, by all means you can. Okay. Um, that individual student outside of, their training can purchase it on their own. It's going to be $25 for a 30-day access. Okay. So they'll pay $25 and they'll have access to it for 30 days. All right. Um, if your students, if you decide you want to have your school or if you're a private sector, your training program, purchase this online course. The registration fee per student is going to be $15. That's 1 5. Okay, $15 for each individual student. And then it is going to be a $75 access fee, okay, for 30 days. So let's say you have 5 students. Let's say you're teaching an adult program and you have 5 students. Um, that will the actual the total registration, excuse me, registration cost for your students will be what, $75, then plus the $75 access fee. So it will be a total cost for your training program for $150. That is a steal, guys. Like that's like I'm giving this program away. Not for long though, right? The price is gonna increase once that 30-day promotional period is over, right? But it is a still, it's a good price, okay, a good cost, and it's affordable right now. No, it's affordable. I'm gonna keep it affordable. And then I haven't worked on the other tiers, so I'm thinking about having a 30-day access, a what was it? 30-day access, 60-day access, and then no, 30 days, 3 months. I'm sorry, guys, I'm so tired. 30 days, 3 months, 6 months, 9 months, and then 12 months access. Okay. And I just haven't worked on the pricing yet for those other tiers. Okay. But that is it, guys. I'm gonna get ready to go to bed because I've been talking. I'm doing online virtual sessions now with nurse aid candidates, and it is awesome. It's like working out really well. So I'm doing that. That's why I'm losing my voice now because I've been talking all day with my students and then all night with clients and stuff. And these are actually $25 an hour, okay, for some additional refresher training, okay, for your students. So yes. Oh, guys, I'm working. I'm so tired. But hopefully y'all enjoyed this presentation. And if you have any questions, you can always email me at NATCEP, that's NATCEP, instructor JAR at outlook.com. Sorry, guys. Okay, so again, NatSap instructor jar at outlook.com. All right. Or nurse jar 1323 at gmail.com. Again, that's nurse jar 1323 at gmail.com. Okay, so any either of those two emails, you can email me, and I usually try to respond within a 24-hour period. Okay. Thank y'all. Y'all have a good one. I'm going to try to get some sleep. Ciao.